Hello, Mary. Thank you for doing this. I know you're talking from Australia, so you are the CEO of the Myo Munchee company, and you're also a chiropractor. So why don't you give us some background on kind of your personal and professional experience and talk about Myo Munchee, and then I want to delve into the mouth breathing side of things, which is why we're talking. So the mouth breathing awareness campaign that I started is, an important thing. So that's what we're talking about. But I'll let you take it away.
Thank you. It's great to be here with you, Sarah. Thank you for inviting me to be joining you in your month of mouth breathing awareness. It's fantastic. I'm really enjoying the journey along with you. I've been sharing some of those posts as they go along.
Awesome.
So my background is I'm a chiropractor. I've been a chiropractor for 28 years now. And I have a big interest in the paediatric side of things, so I work a lot with new babies and young children, and development is what I'm really interested in. And I also happen to be the CEO of the Myo Munchee company, which my father was the inventor of the Myo Munchee over 50 years ago.
Yeah, it's so cool.
So with that, so I grew up with a dentist as a father, so coming from but with always a great understanding around function, how important function was. So that was a good match-up for me in my chiropractic space to be really interested in facial growth and development, because a lot of it's about function, isn't it?
Mm-hmm. Yeah, and I love your perspective, because I've talked to a lot of people who are focused on adults and sleep and, so many aspects that we haven't covered, and one of that is the kids. So how do you see mouth breathing affecting growth and kids, and what are some of the things we can do early on? I mean, with a baby, I get asked so many times, how do you stop a baby from mouth breathing, or what do you do?
Yeah, it's big, isn't it? Because this is what we do see, and I just had some little twins in this morning, 2-month-old twins, little babies, and one of those little babies had had a tongue release done about a month ago, and one of them was okay. And they present to me for different reasons, but I'm always looking to see what's happening around that facial area for sure. And the little boy, the little baby, he had a blocked nose today. Now, this is one of the things that when you haven't got that ideal tongue function, the sucking, the breathing, the swallowing, when that suck, swallow, breathe isn't working from those very early phases, the sinus drainage, all those things can be affected, and you start getting those little blocked noses. Now, we know that breathing through your mouth isn't normal, because babies don't breathe through their mouth as a normal thing. They breathe through their nose. We're born to be nose breathers, obligate nose breathers, and breastfeeding really makes that happen, which is fantastic. So when it all works really well, and the tongue's sitting on the roof of the mouth and the baby's breastfeeding and the suck, swallow, breathe is working correctly, that's what's happening. And so that's why it's such a good process when they breastfeed, because they have to breathe through their nose.
Yeah.
So problems can set up when the child can't feed well, and that's when it's that cascading effect, isn't it? Mm-hmm. When they can't suck as well, so they're not draining the sinuses as well, they're much more likely to get the blocked noses. Their nutrition isn't as great, because they're not getting the natural human breast milk. They're often then feeding with cow milk proteins and different things. And then you can start to see these patterns of mouth breathing setting up. And that's when, very early on, if you see little babies with their mouths open, you're like, oh no, the body's gone into a survival mechanism to breathe. It's gone into that survival space of mouth breathing. And it's finding the tricks that we can do to help get that little body back on track. Yeah. So do you want me to talk a little bit about it?
Yeah, show me that. I know you were just showing me that little baby Myo Munchee. I'd love to see it again if you hold it up to the camera. It's so tiny. So what age can you actually use that with?
Well, this is brand new. It's called the Munchie BB, and it's just arrived in my hands. We're going to start trialing it. So why I wanted to develop a smaller one was so we could get in a little bit earlier and start to try and stimulate that system, because we see those babies under the age of 1 who have developed this mouth breathing pattern, and we want to try and get as much good information into that system as we can. So I'm hoping from about 10, 11, 12 months of age we can start to use, even younger maybe. I have heard of some providers using cutting down munchies that we already have, for babies younger than that.
I've heard of people doing that too.
Yeah, 5 and 6 months of age. So even trialling it with that sort of age group to see if we can get the baby to engage with it, with the gums. So it's a different experience to chewing a normal munchie, because normal munchies are working with the teeth. So the idea of the baby munchie is to just stimulate that oral space, stimulate the jaw arch form, bringing the lips into function, getting that tongue really engaged, really getting the tongue to move around and really start to bring much more awareness, because so much brain sensory information is around that lower third of the face.
Yeah.
And when it's weak and it's mouth breathing is the pattern, it's much weaker. And so we're not getting as much good feedback to the brain as we should be getting. So we're hoping that this can be a little tool that we can help engage the baby so the brain will start to get back onto stimulating and activating into that, lips and jaw area.
That's so cool. Now, something that I hear a lot about, and I think maybe you'd be a good person to describe this a little bit more, is when babies are mouth breathing or their tongue's not in their palate, then they get something called a bubble palate, which is basically, I think, just a really vaulted palate. And this causes a deviation in the septum. And so from an early age, we can see these structural problems happening. And I don't know if you have any information on that from a chiropractic perspective, if you're seeing that with the babies and the connections between the adults with the deviated septums. Is that something you see?
Absolutely. It's such a malleable, moldable system. Yeah. And those forces that can create change, they're so minuscule. The amount of, we know what will happen from sucking on a dummy. We see that. They should be classified as an orthodontic device, shouldn't they? So it's when they can't get that tongue into the right position, and when those aberrations are there early, that's how the system grows. And absolutely that strain comes through. So, yes, there's a lot of very small bones in the facial area, and then we have bigger bones of the skull. But in a baby, they're so pliable and moldable. And that's why I love to do the work I do as a chiropractor, a craniopath. That's the sort of work I'm dealing with, is balancing those any strains that are in the system, and really trying to promote for those little ones who, as you said, if the tongue's not able to do its work, because when the system works, it's all programmed to work perfectly. And sometimes the program has had a glitch in the system, for example, the tongue being anchored and not being able to do the amazing work that it should be doing. And those palates they're so high, those little babies I thought this morning, the tongue, how does that tongue even get up there to breastfeed? Like one of the little babies was really struggling with breastfeeding, and you feel those high arched palates and think, wow, you've got to try and help get that tongue up there, but also working with a craniopath, someone who's in that space, to be able to optimise the growth, and then making sure they're nose breathing. And this is something we can do. It's by stimulating some of those muscles. If there's flaccidity around that area, we can do simple work. People who are trained in this space, I just did a wonderful course earlier in the week. Ellen Carlin was in Australia. She's a speech pathologist who's been working in this feeding space for a very long time. And just some simple, wonderful techniques of stimulating around that oral area, and how important it is, especially for those little babies who've had tongue release and they don't even know what their tongue's doing. So you can help get them, educate them on how to use it. And once the tongue starts to engage and the lips come together, the nose can work. So
and those it's the infants, the little babies, a year and younger, and even a little older, that I think parents, they see this stuff and they're just like, what do I do? So it sounds like that's a good practical thing. Is I've heard of different cloths and stuff that you can use to stimulate, even just touching the baby left or right and trying to get them to move their tongue. There's so many little things that a mom can do to help. And
stimulate the gums, and they really like it. The little baby really likes this taking your finger, and they have these little chew reflexes where they want to chomp. Even from an early age, you put your finger on the gums and that reflex will start to just give a little gentle chomp. So it's just, rubbing that along the gum line is really good. And the tongue can't help but be interested. Very interested in what's going on, and in that whole oral area. So as you say, any of this kind of stimulation around this area, just very gently brings greater awareness to the area. Yeah.
So that's good. And then, of course, working with a professional, sounds like cranial sacral therapist or a chiropractor with some of that cranial adjustment type training. Do you have a good way? I mean, I'm guessing it's different in Australia than the US, but how do people find somebody with that type of knowledge? This is a question I get asked a lot, and I'm just like, it's so individualized. Like every chiropractor or cranial osteopath is, they kind of have their own training and techniques in a lot of ways, and I don't always know who to find. I mean, do you have any advice on that?
Well, I'm trained in and certified in a technique called sacro-occipital technique. Now, SOT is a well-known world organisation, and it exists. There's a lot of practitioners in the US and in Australia.
Well,
so that's a great place to start, because all SOT practitioners have done some level of cranial work, and so they will either let you know whether they're confident with babies, that's something they've got a lot of expertise in, or whether they work more in an adult space. But most of them do go into the paediatric space. But yes,
okay. I mean, really, if you can just guide that growth from a young age, you can avoid all the problems with the adults that I see. We can just get to it young enough, like guide the growth, get the nasal breathing, get the tongue up, the lips together, and I mean, it's really that simple. So.
And it is amazing how much of an impact those early habits have on growing what my father used to call a good quality face. A good quality face is so important for breathing, eating, swallowing, communicating. We need this whole area to work really well. And as soon as you have an undermining in the probably the most important piece of that is the mouth breathing, because once that's occurring, it's a pattern that then gets established into the brain starts to coordinate that and becomes a much bigger thing. There's a physiological response.
It does. And that strong habit that starts with, it's so simple, it just starts with the mouth being open, maybe because of a tongue tie or I guess trouble with breastfeeding. But then that open posture, it doesn't have to be because of congestion. But I really think, and I think a lot of people in this field and industry really understand that it's the mouth breathing that causes the congestion. So you mouth breathe for long enough, and now you've got more allergies. You're more affected by, the common cold and flus, and you're just more likely to get sick and have mucus, and then get the large tonsils and adenoids. And I'm sure you see that all the time.
Yes, and I think for some parents, they can see that they don't want their child to have the same outcome they've had, because they've been struggling away with a lot of those things you're talking about, the science, the allergies, the this and that. And so they want these different outcomes. So it's really looking at the structural, what can we do to make sure that it's not the structure or the flaccidity in the system that's not able to work well. And there's simple things we talked about. And then there's also looking at, like you say, that allergic response of gut function. Gut function is so important in babies.
Oh, my God.
The probiotics and making sure that gut is established early on. So little babies who've been caesarean, for example, it's a really good idea to do probiotics from day one with them, a little course of baby probiotics that really help establish the gut flora in the system because they haven't had a vaginal birth. That can be a really great way to start looking at things like just getting a really good understanding of the nutritional, how to start bringing foods that are going to give them the best gut function over that first year of life particularly. And that first 6 months, making sure they don't feed the baby anything other than breast milk, because in an ideal world, if that feeding goes well, etc. So the gut's very porous, and if there's foods brought in, quite often it can end up making them more susceptible because of that leaky gut that can occur because the membranes are so tenuous at that point. At 6 months, they start to seal up and they're able to cope a lot more. So it's a complex process, but there's some simple ways to really help get the best outcome.
That's so interesting to me because, I don't have kids, and I think I definitely, if I ever have a baby, I need to talk to you about this stuff, because that gut health, I get that from an adult perspective, but I never thought about the baby's gut, and that's really the start of everything for our health. So what are foods to either avoid or to give to a baby who's after that 6-month age? I mean, what should they be focused on or not focused on?
Yeah, well, I mean, I wouldn't like to put my hand forward to say I'm a specialist nutritionist, but I basically keep it very simple and make it whole foods, absolutely got to be whole foods, and avoid your grains and anything too complex. But giving them, yes, small tastes of food and things, but yeah, it's about giving them different textures to experience and just understanding, keep it very simple, because their little systems are you don't want to, in any reaction, really giving yourself an opportunity to note what's in the food so you can get if there's any reactions. And so that's sort of important part too, rather than foods that have lots of different things in them that you're giving them to them at once. So then it can be, oh, they had a reaction to that. What was that? We don't even know. So it's trying to keep it really simple and manageable, and understanding if they're still breastfeeding at that point, food is of an interest. It's not be their primary source of nutrition. So milk is definitely their primary source of nutrition for the first year.
Well, I love that baby-led weaning movement, and I'm sure you've heard of it, where, the kids, the little babies, really, I think as long as they can sit up and they're able to, I think it's like 6 or 8 months is about the age when they'll do it. And they've been screened for tongue ties. I think that's an important thing. But the ability to put the food up to their mouth and to gum, like a piece of avocado, and just be able to learn that control of their mouth, and that's setting them up so much for how they use their mouth later. And so I love the baby-led weaning movement because of the coordination and the muscle use. And, I think the gut health aspect is so connected even to that too. So do you do much with the baby-led weaning, or do you talk about that a lot?
We definitely talk about, definitely that idea of watching out for this idea of spoon-fed purees being all they're doing for that, because what's tending to happen. I will just touch on, though, that this course I was at earlier in the week, she was saying, Ellen was saying that she thinks that purees have a real purpose. She said they're an important part of it. She was a little bit, she likes baby-led weaning as an idea, but bring it in a little bit later. So that was interesting to hear someone talking a bit about, and she's a speech pathologist coming from the tongue function perspective. So it was interesting hearing about purees having a place.
Yeah.
So I thought that's interesting too. But one of the things that she really talked about, which I thought was really true, what happens then, so these babies take purees, they then get stuck on the purees, so all the parents interested in how much we can get in, making sure they're getting it in, and then they go from spoon puree to suck down packages. Have you seen those?
I have seen those, like a little, like it's applesauce or something in a squishy tube. Yeah.
Now this is a disaster. This is a disaster for facial growth and development, and for children's interaction with food. It's really interesting. They don't get to smell, touch, or feel those textures. That thing straight in. It's really interesting, that real disconnect. And that really resonated with me when she talked about that. The baby-led weaning is great because the child's feeding it, it's looking at it, it's getting a sense of what that thing is before they put them in their mouth. There's a whole lot more to eating than just suck it down or push it in.
Well, and that's where the whole chewing conversation comes in, which I know you talk about a lot with the Myo Munchee and chewing and everything that's so good that comes from that. And getting the kids to gum food before they even have teeth is getting those chewing muscles, the muscles of mastication, activated, and they're using their tongue. And it's amazing all of these processes that happen when we're so little, and we don't even think of it, and so I don't know if you want to add anything else about chewing, but it's such an important thing.
It is such an important thing, and it's there very early. Those reflexes for chewing are there.
I didn't know that, actually, with the babies having that reflex when you touch their gums. That's new to me.
Yeah, there's little chew reflexes there, and it's helping to stimulate that jaw stability, because this whole process of breastfeeding, it's very hard work for the babies. So eventually the jaw starts to develop its own stability, so the jaw can hold itself, so the tongue can activate as they get older, and they need to use more force to get more milk out at becomes more stable around here, these chew reflexes. But then they're very much ready to kick into, at 6 months, starting to use them a lot more. So the tongue is what's controlling a lot of that growth and development early on, and it will continue to do so. But it's very much pulling and stretching forward as they're breastfeeding. So the chewing, as they start to chew, and they want to develop that discriminative mouthing, where they become very aware of how much force they've got in their jaws when they start. So when they get their teeth in,
yeah, it's like proprioception, like the feedback from how hard you're biting.
That's right. And I think that's what's missing a lot of the time for our kids, for some of these kids who've been on those suck and squidgy food things. They're missing that discriminative mouthing. So I think about my puppy. Well, he's 2.5 now. When we first got him, he had the sharpest, hardest little teeth, and he would bite. And it would really hurt. He's got the world's strongest jaws. He carries sticks around all the time. He's a little dash hound. He carries big, heavy sticks. But he knows how to be gentle. So he'll play with it, he'll bite, but it's that discriminative mouthing. He knows not to do that. Now, I think what's happening with some of our children's jaw development is because they've missed that vital piece of early chewing stimulation, they don't get that correct amount of force, and they start, it's either overclosed and the jaws don't develop their correct height on the teeth because the jaws are overclosing and the teeth can't properly erupt. Or they just haven't got enough strength in there. So they've not enough awareness. Yeah, I think that's really interesting.
It makes me think if there could be some connection to like all the clenching and grinding. I mean, there's a tongue-tie component to that, but I just, what you're saying is making me think like, I wonder how that's related to other things that we see in adults,
Yeah, and it's really interesting too. We're going off mouth breathing on the chewing.
Yeah, that's okay.
The different aspects of chewing and I was just going to talk about behavioural stuff. There's really interesting things on dopamine production and chewing and how it's calming. And just to see these little babies, how much they enjoy when I'm stroking their gums and they're chewing. They really like it. So
what was the hormone production? I missed it. It was
dopamine production.
Oh, dopamine.
Brain, yes, it's the feel good. Oh. And we have someone who's been using the munchies with an older population, teenage population, with self-harming, and finding that chewing the munchies is helping keep them feel calmer and in the world. So it's just a really interesting thing, chewing. But back to mouth breathing, chewing is also really helpful for mouth breathing because it keeps your lips and jaws strong to keep them together, gives your jaw strength to stay up. Yes,
I mean, the mouth breathing conversation, the chewing conversation really are connected, So, that's one of the reasons I wanted to talk to you is just to make these connections. In my practice, I mostly see older kids and adults, babies and kids under 5. They're not my specialty. They're not my area of expertise, although I can still help in a lot of ways. But I love talking with people like you that's like what you do. So how many babies do you think you see in a day or a week? I mean, how often are you really working with this population?
Yeah, I work with them every day. That's
so cool.
20 or 40% of what I see is little babies.
Wow, okay, I love that.
Children and but I go across the board and see adults as well. But I really love working with those little babies because and there's such simple things that you can do to help. And the parents don't know a lot of the time. So if you can give them some little tips and tricks that can help enable that system to just get back on its best track, then that would be profoundly helpful ongoing. It is. It's really important that they are aware without being too worried because but it is amazing how much change you will get in a week. Once you start giving the system the right information,
I've seen it. I mean, I've seen like in babies, palates look different and the musculature on the mouth looks different just with, some of these like really simple techniques or stimulating and even just little things too, like when the baby's asleep, just close their mouth. If their mouth's open, just close it. It's so simple, but...
And give them a little bit of, like if they're on tummy time and their jaw's dropping out, just bring it up. Just bring it up and activating the tongue from under here. You can get a little bit of pull the tongue, push the tongue up, just little things that you can do to just, and if you did that 5 times a day, that's 5 times the brain gets that information. 5 times, and they're little exercises. They're like, and eventually the muscle groups start to get that activation and stimulation. So it might seem like, oh, what's the point of that? But actually there's a lot of point of that.
It is.
It's fighting against a pattern that's starting to get more entrenched. It's allowing the brain to get a different bit of input. And that's what we need, is that input. Yeah.
Oh, that's
so
having
cool. Babies, go.
You mentioned tummy time. I know that's a big thing for restriction. So with the tongue and the fascia, and even just like, I mean, it's an amazing exercise to do for babies. But do you see anything with the connection to breathing with that?
I think so, in that opening the whole system. What we're tending to see with a lot of babies is that they're still shut down. So they're born in a curled up state, and then they should be opening and strengthening. And that diaphragm, which is a big part of your breathing apparatus, your diaphragm should have plenty of space to start really working. And one thing I'm really seeing is babies are in capsules for a lot longer than they would have been. So the little capsules that they come home from the hospital in, and they're safe travelling in the car. Now, when they're in that space, they're in a curled up position. So that's a lot of pressure on the diaphragm. And what can happen is that they can be in those a lot of the day when they're little, because you can transfer to the pram from the car, and then you're out and about, and then you get home and they're asleep, so you pop them, just have a little more of a sleep in there. And before you know it, they can have spent half the day in that curled up.
Oh gosh.
And I'm really seeing this, and what's happening now is capsules can be used for 6 months. So instead of it just being the first 6 weeks to 3 months, because by 3 months the baby should be fully extended and really pushing up into that, real open chest, and they're not. Yeah. I'm just seeing a lot of babies who are not, and so I'm really only sort of became really aware of that more recently over this year and last year, just to see, these mums are struggling with these huge babies in these capsules, and I'm like,
it's hard on the moms too. They're getting like sore necks and shoulders because they're carrying too big of babies around.
Disaster. And so you've got those babies that are still like that, and that is really compromising the way their diaphragm can work. So I think it is having an impact on
that makes me think like the babies who are stuck in this position are going to be the adults, probably with more of the issues like even like anxiety. I mean, if you're breathing through your upper chest because your diaphragm's not activating, long-term effect of that is anxiety and stress, and this type of posture is just so hard on your neck, and then it plays into the airway stuff, and it's all, I mean, you've got to start this so young.
Yeah, that's right, and it is just awareness. And so I said to the mum with the twins this morning, who's 2 months old, and neither of them can do tummy time, like they're really struggling. And I said, okay, we got to start really getting onto that. I know it's really hard with twins. And I just had to start that conversation too about the amount of time in the capsule. And so, and it's just planting those seeds. And then it's another one we want to plant the seeds with mums is the dummy as well. We call it a dummy, you call it a pacifier.
Oh, yeah.
It's the amount of time that's in there, just really helping people understand that weakens the whole area too. So they're much more likely to mouth breathe longer term if they've had long-term use of a pacifier.
That would make sense. I didn't think about that as actually weakening, but that, of course, I mean, that makes so much sense. The lip seal doesn't need to ever be there if the pacifier dummy is in the mouth for a long time. So, but what else were you saying? I cut you off.
No, I was just touching on to that, but just, that's just being aware that if you give the parent the information, they can then make a choice around it and understand. Mm-hmm. So that's what we're trying to do, is have the conversations early to give people information so they can make a choice that'll hopefully get them a better outcome. Because a lot of the time they're not aware of the long-term implications of these.
And it seems in society a lot of these things are so normal. I mean, I was just having that conversation with someone earlier today. I was saying, mouth breathing is so common, and, like having the babies in the carriers or the capsules, it's so common that we don't think of it, but it's not actually normal or good. A lot of these things that we do in our modern society, it's just common, but it doesn't mean it's like should be happening, you know. So mouth breathing, pacifiers, even the thumb habit. I'm sure you have some theories on that. You know, the thumb in the mouth, but
well, at least with the thumb, a lot of the time they are active around it. They're actively sucking and activating their. Not ideal by any stretch, but I think better than the pacifier in that it's all weakened. Then it's at least with the thumb they kind of pulling it in, and generally they're breathing through their nose while they're sucking their thumb.
That's true. Yeah, at least they are nasal breathing. Now, I guess, you know, we've covered a lot of good stuff, but I have a quick question. I think this is going to be such a good video for a lot of the parents and stuff. So with thumb sucking, I hear a lot of what kids are trying to do is release dopamine or endorphins from palatal stimulation, like the thumb to the palate. From a cranial perspective, I mean, what's going on with that, and what do you think?
Yeah, and definitely we've always looked at it from that perspective too. They're trying to drive the system, that there's jamming in the cranial system. They're trying to get that cerebrospinal fluid pumping, flowing. They're trying to work that system that the tongue should be doing. The tongue's not doing its job properly, chances are, and that thumb is really enabling them to get that movement into the system. So yeah, that's
so interesting.
What we're looking at. Yeah.
And then when the thumb is in, the tongue is forced to the bottom, and then when the thumb is not there, they're typically mouth breathing. And so all of these things, you know, they all go together. And then, of course, the thumb emphasizes the narrow palate, the vaulted palate, all the problems.
Yeah, unfortunately, that's right, and you can't chop that arm off.
No. That's funny.
So it's a much more complex process, the thumb sucking, to take out of the equation. But yes, looking at why they're seeking something. By doing that, they're definitely trying to stimulate the system, and they're doing it as a young, like sucking it under the age of 6 months is quite normal.
That's for sure. But if they're 4 or older, you know, 5, 9, that's not.
Yeah, that's way beyond a habit at that point. That's got to become
totally. Yeah. Well, I mean, we've covered some good stuff, and we've definitely touched on mouth breathing, but I think the takeaway from this conversation is that the mouth breathing is kind of the tip of the iceberg in a lot of these other developmental things that are going on with kids and habits and so much else. So I guess, is there any last words you want to say to parents about, you know, what they should be looking for, or, you know, if they're concerned, some things they can do?
Well, I guess it's just it's being aware, having a little look, and making sure the baby has plenty of time to move, plenty of freedom around that upper chest diaphragm area, looking at that from a mouth breathing perspective, opening, doing that, like you said, closing the lips when they're
stimulating,
falling open at night when they're asleep, just closing the lips, and just understand that nose breathing is what we want, and that is we don't want to end up with a mouth breathing pattern just through a habit. So if they're finding that the baby's rest posture is with a mouth open, check in with a practitioner if you can. Find someone around you who can have a look and see if there's some reason why, as you say, whether there's tongue release, tongue-tie issues there, or some other reason, or whether there's low tone in the system. That's another reason why babies will have their mouth open, that there's low tone. So the whole system has low tone, and there's things you can do to help improve the baby's function to get things working better. But yeah, if the mouth is open habitually, if that becomes a thing, then yeah, check in with someone who can give you a little bit of guidance around how to get that sealed up in that nose working.
Yeah. Good. Well, we should also give a little plug to the Myo Munchee tour, since we're both going to be. I was invited to be part of that with you guys, and you're coming over to the U.S. And so yeah, maybe share a little bit. So if there is any professionals listening, maybe they can get a chance to meet both of us and learn more about the Myo Munchee. And I'm sure you'll have that little baby Munchee too, right?
I will have the little baby with me, which is very exciting. So yes, we're coming to the US. We're very excited. 2 weeks' time, and Sarah's joining us, which is going to be a lot of fun.
Yeah, I'm excited.
So, off in LA on the 8th of June, and we have myself, and just talking from the chiropractic cranial perspective, I'll be presenting my father's dental work, 50 years of dental work. We'll have Dr. Dan Hansen talking from the dental perspective, and my brother Peter Bourke, who's also a chiropractor of 35 years experience, talking from the adult cranial TMJ perspective. So we've got lots of good information there, and we're excited. So we've got LA, 8th of June, then Seattle on the 10th, then, or 11th, I can't remember the date exactly, Chicago, St. Louis, then Dallas. But have a look at our website, myomunchie.com, and come and meet us. Yes, we'd love to see you.
Yeah, it'd be fun. Yeah, and I'll link all the details in the video information. But yeah, I mean, if there's anybody who wants to come learn about Myo Munchies and talk to us more about all this stuff, then that would be awesome. So hopefully we'll get to see some people there. Well, I think, it's been a good chat. So thank you so much for doing this. And I look forward to seeing you in a couple of weeks. We'll be meeting in LA for the first presentation, I guess. So that's exciting.
Thank you for having me, Sarah, on your Mouth Breathing Awareness Month.
Oh, you're welcome. Thank you. I really appreciate it.